This Psoriasis Awareness Week, we are exploring the lifestyle factors that may be important to consider when living with psoriasis or psoriatic arthritis. It is a privilege to introduce Professor Chris Griffiths from the University of Manchester, who has carried out numerous pieces of research in this area to help us set the scene ahead of Psoriasis Awareness Week. So, Professor Griffiths, are lifestyle factors such as diet and exercise important in managing psoriasis?
Well, Helen, this is a very good question. And every psoriasis clinic that I've done many psoriasis clinics over the years and talked to many thousands of people with psoriasis around the world, actually. One of the key questions they ask me is, what can I do for myself? And diet always comes into it. And so I guess we will expand on this further, but diet can be beneficial, and certainly lifestyle or exercise can make a difference as well. So as far as diet's concerned, I don't think there has to be any specific diet. People are concerned they might be allergic to something, or that's not the case at all. There are one or two small studies which have shown that maybe a gluten-free diet might help a very small subsection of people, but overall it's not relevant. There is some work from the past which I do think has some relevance, is that diet which has a high content of omega-3 fatty acids such as oily fish is actually probably helpful, but that may be for other reasons. But overall, a balanced normal diet is absolutely fine. It doesn't have to be any exclusion diet specifically.
So are lifestyle factors such as diet and exercise important in managing psoriatic arthritis?
Well, I guess that diet and lifestyle factors are important in managing psoriatic arthritis. I guess, again, diet, omega-3 fatty acid containing foods such as oily fish may be beneficial. There's been some evidence for other forms of arthritis as well that might well be the case. And then exercise is important, particularly that's guided by a physiotherapist in the case of psoriatic arthritis. But there is good evidence that physiotherapy, which is really exercise, is beneficial for psoriatic arthritis. But I'm sure that we'll talk in more detail about other lifestyle factors and exercise itself.
Can any particular lifestyle factors, such as diet or lack of physical activity, make psoriasis better or even make it worse?
Well, it's my view, and certainly the work that's come out of a National Institute for Health Research funded program, which the Psoriasis Association were part of, and we ran from Manchester for about 5 years, called the IMPACT program, looked particularly at these important factors. So not necessarily the medicines we use for treating psoriasis, but the way that we can influence the lifestyle and how that in its own right can benefit outcomes in psoriasis. So losing weight to get is important. There is a strong association between weight gain, obesity, some people, and psoriasis. And so we know getting people down to their normal weight, their ideal weight, is beneficial for two reasons. One, there is an interaction between the body fat and inflammation. Those are the chemicals that drive inflammation, not just in the skin, but in other organs, so that drives psoriasis. But also, being the ideal body weight means that the various medicines that we use for psoriasis, such as methotrexate, cyclosporin, and some of the new biologic therapies, work much more efficiently if the patient or the individual is at their ideal body weight.
Can any particular lifestyle factors, such as diet or lack of physical activity, make psoriatic arthritis worse or better?
Well, again, I think that the diet it would not be any particular exclusion diet. As I've mentioned before, I think a diet that contains omega-3 fatty acids may be beneficial, as it's been shown for other forms of arthritis, so oily fish, for instance. And then exercise and weight loss, particularly, may be beneficial for psoriatic arthritis, pretty much for the same reasons that we know for psoriasis, because the two diseases are very closely related.
Are people with psoriasis at an increased risk of developing any other conditions? And so could diet or exercise help to prevent these other conditions?
Yes, well, there's a very good literature now developing all the time that shows that psoriasis is obviously primarily a skin disease, but it is associated with other illnesses. So other diseases which affect other organs of the body. The most obvious one, of course, is psoriatic arthritis, which is associated in about 25% of patients with psoriasis. But there is strong evidence now that psoriasis is associated with heart disease, increased risk of heart attacks, not necessarily due to the psoriasis itself, but the fact that people with psoriasis carry risk factors for heart disease, such as having a high cholesterol. So it's important that patients with psoriasis have their cholesterol checked. And then, of course, a diet which is low in cholesterol, or maybe even cholesterol-lowering drugs in some cases may be needed to be prescribed. There is a link with diabetes. Again, that's probably the link due to the fact that patients with psoriasis, as a general rule, tend to be a little bit overweight. There's a certain form of diabetes called type 2 diabetes, which is associated with being overweight. So losing weight in these patients would definitely reduce the risk of developing diabetes, and certainly type 2 diabetes, which is not usually the insulin-dependent type. Depression is associated with psoriasis, not always directly as a consequence of people feeling, understandably sorry for themselves and stigmatized. It may be due to some inflammation actually in the brain, which is linked to the overall inflammation that we see with people with psoriasis, which may in turn lead back to the fact that they may be overweight. And then there are some patients who have an increased risk of liver disease. And then there's links, of course, to smoking and drinking alcohol. So if you look at the things that people can do to help themselves, and that's what, we want our patients with psoriasis to be able to do, and that's what they would like to do, is yes, we can prescribe a medicine. We have some very good medicines now for psoriasis, but there are things that the person with psoriasis can do to actually improve the effectiveness of those medicines, but also on their own to improve psoriasis. So losing weight, getting more exercise, stopping smoking, stopping alcohol intake, or certainly reducing excessive alcohol intake, and more sleep, all of which can help the management of psoriasis. So in Manchester, and as part of that impact program that was run by the National Institute for Health Research, we developed something called the So Well program, which I know the Psoriasis Association has been very closely aligned with, which is around motivational interviewing to get people with psoriasis who have these other conditions, such as being overweight or they're smokers, to actually change their lifestyle. It's easier said than done, but perhaps we can discuss that in a bit more detail.
So you mentioned motivational interviewing. Would you like to talk to us about that? How can people with psoriasis or psoriatic arthritis get the most from their treatments, or improve their conditions?
So motivational interviewing is a psychological technique which is used, which we have a training course for called the So Well program. So if, for instance, you're a person I was seeing in the clinic with psoriasis, Helen, and you were overweight, not that you are, Helen, but if you're overweight, and I was having a discussion about, psoriasis and what we know about it and the treatments we have and how you can help yourself. If I said to you, and also you need to lose weight, you wouldn't take very kindly to me saying that. And probably your immediate reaction is, well, I'm not going to forget that. I'm not going to try doing that. It's too much of an effort. If I said to you, though, Helen, on a scale of 0 to 10, where 0 is not interested at all, to 10, I really, really want to do it. What would you like to lose weight? And you probably would say, well, maybe 3 or 4. Mm-hmm. So I would say, okay, that's interesting. Why isn't it less than that? It's surprising to me that it's 3 or 4. And then you'll come back to me with some reasons as to why. So, well, I've heard that being overweight might increase my risk of getting arthritis. It may increase my risk of diabetes. And there, once you started to say that as a patient, you start to get ownership over this program. So it's rather than me telling you what to do, it's you saying, okay, I'm going to work with you, and this is something that I've got ownership over, and it's more likely to work out. That's true with lots of things in life, but this is particularly true for lifestyle change. It seems to work. It seems to work as well. That's the key thing.
That's what we all want.
Yeah.
So overall, what message could you give to people with psoriasis and or psoriatic arthritis to get the most from their treatments and their consultations?
Yeah. Well, I think that we've advanced a lot in our management of psoriasis over the past decade or so, and that's in no small part due to the work of the Psoriasis Association, the identification of the Psoriasis Association recently in the priority setting exercise, which actually put these sorts of things right at the top of the agenda, or very close to the agenda of the priorities for patients and the priorities for people who look after these patients, is that lifestyle change, diet, etc., are very important. And I believe that it's a contract between the clinician, whether it be a doctor or a nurse, and the patient with psoriasis. There's things that we can do. We've got some great drugs now. We can get you on to probably the best medicine for the form of psoriasis that you have. But there's things that you can do to help yourself. And that is taking those medicines as they've been prescribed. There's often a bit of slippage. I know that, even with the biologic therapies, but it's important to take the medicines as they've been prescribed. That's how you can help yourself. But also, losing weight or coming down to an ideal weight is going to benefit the psoriasis directly. It also will benefit the efficacy of those drugs. Stopping smoking if you're a smoker, reducing or even stopping alcohol intake, because that can make psoriasis more difficult to manage. Having your cholesterol checked, I think, is important as well, because people can be unaware of having high blood pressure, high cholesterol. So that's all important sort of things that you can do to keep yourself healthy. And also getting as much sleep as possible. That definitely is of benefit as well. So it's really advice about, psoriasis. Yes, it affects the skin, but it also affects every aspect of the person who has psoriasis, everything from the psychosocial aspects to physical aspects.
Thank you very much for joining us, Professor Griffiths, in the lead up to Psoriasis Awareness Week.
Yeah, thank you.